and welcome to A Sound Constitution here on CHLY 101.7 FM, a show where we focus on health topics important to our community. This year's team is made up of 8 third-year VIU nursing students. Our goal is to demystify health issues and address common misconceptions by sharing evidence-informed information from a variety of reliable resources. All information provided on our show will be available in our show notes on our Facebook and Instagram pages. We want to remind our listeners that the information presented in the show is for educational purposes only and does not replace the advice of your primary healthcare professional. If you have any questions or concerns about what's being discussed, feel free to reach out to us on Facebook at A Sound Constitution, on Instagram at CHLY A Sound Constitution, all one word, or Twitter at ASC_VIU, or email us at asoundconstitution@gmail.com. We would like to start our show by acknowledging that we are on the unceded territory of the Snuneymuxw people with a broadcasting range that overlaps the Gwich'in and Sliammon territories. This acknowledgement is done with gratitude to the Snuneymuxw people and with the intention to increase awareness about truth and reconciliation processes and efforts on Vancouver Island. Additional information and resources surrounding Snuneymuxw history, reconciliation and protocol, and land acknowledgement can be found on our Facebook, Instagram, and YouTube pages. I'm your host, Nicole, and joining me are my fantastic co-hosts, Jamie, Lauren, and Luke. Today we are talking about sexual health. It's a topic that can sometimes feel awkward or even taboo, but that's exactly why we're addressing it head-on. Our goal is to navigate through misconceptions, illuminate the facts, and chip away at the stigmas surrounding sexual health conversations. We have an informative episode lined up for you. We'll talk about sexual health across the lifespan, provide some vital information about human immunodeficiency virus, or HIV, and have a conversation with Anita Carroll from Options for Sexual Health. Additionally, we'll be sharing the latest news on HPV screening and some other interesting facts that might just surprise you. So, without further ado, let's get to it.
Hello, and welcome to this episode's quiz on sexual health. Let's break the ice. Question number 1 is true or false? Being in a relationship or having a sexual history with someone implies consent. The answer is false. According to Safe Campuses BC, consent is an active process and never assumed. Thus, communicating about consent is always necessary. Question: true or false? All Canadians become sexually active at 18 years of age. The answer is false. In 2018, the McCreary Centre Society surveyed 38,000 British Columbians between grades 7 and 12. Their findings, titled the BC Adolescent Health Survey, found that among youth who had ever had sex, the most common age for first doing so was 15 or 16 years old. Question: birth control pills were illegal in Canada until what year? Is it A, 1920, B, 1950, C, 1899, or D, 1969? The answer is D. According to the Canadian Encyclopedia, both contraception and birth control became legal in 1969. Question: at what age can people no longer have sex? Is it A, 45, B, 65, C, 80, or D, sexual activity is possible throughout the lifespan? The answer is D, sexual activity is possible throughout the lifespan. According to healthing.ca, in a 2002 edition of its bulletin, the National Advisory Council on Aging, titled Sex Over 60, cited a survey that reported a large majority of Canadians between 65 and 74 describe themselves as sexually active. Question: true or false? The following quote is the sex ed mission statement from the Nanaimo and Ladysmith School Board. Quote: the goal of comprehensive sexual health education is for all people to gain the skills and knowledge required to maintain healthy bodies, healthy relationships, a healthy body image, and to know what to do in unsafe situations. The answer is true. The following statement can be found in the school board's 2018 Physical Health Curriculum.
Hello everyone, it's Jamie here, and today I would like to delve into an important topic that affects millions worldwide. Human immunodeficiency virus, or HIV. All of the following information I'll be sharing today is backed up by the Government of Canada website. So I want to start by dispelling some myths about HIV. Contrary to popular belief, it is not a death sentence. With proper treatment, individuals living with HIV can lead long and fulfilling lives. However, if left untreated, HIV can progress to acquired immunodeficiency syndrome, or AIDS, which does weaken the immune system. Recognizing HIV can be challenging, as symptoms may not appear for years after infection. When they do, they often resemble flu-like symptoms such as fever, fatigue, sore throat, muscle aches, and/or swollen glands. This underscores the importance of regular testing, and fortunately, HIV testing is widely accessible across Canada, including here in Nanaimo, offering options like anonymous and rapid testing with immediate results. It's crucial to remember that HIV testing should be accompanied by testing for other sexually transmitted infections. Healthcare providers will typically perform these tests using various methods including blood tests, urine samples, swabs from the genital area, or oral swabs. The choice of testing method could depend on factors such as the individual's sexual history, symptoms, and preferences. Now let's talk about how HIV is transmitted. HIV is primarily transmitted through specific bodily fluids such as blood, semen, vaginal fluid, rectal fluids, and breast milk. The most common mode of transmission includes unprotected sexual intercourse, sharing needles or syringes, and from mother to child during childbirth or breastfeeding. But here's the good news. There are effective prevention methods available. Condom use during sexual intercourse can significantly reduce the risk of HIV transmission. And for individuals at high risk of HIV infection, there's pre-exposure prophylaxis, also known as PrEP, which involves taking a daily pill to reduce the risk of acquiring HIV. Additionally, post-exposure prophylaxis, also known as PEP, is available for those who may have been recently exposed to HIV, providing a short course of antiretroviral medications to prevent infection. Moving on to treatment, highly effective antiretroviral medications are available to manage HIV. Early treatment not only improves the health of those living with HIV, but also significantly reduces the risk of transmission. This emphasizes the importance of undetectable equals untransmittable, also known as U equals U. In simpler terms, when someone's viral load is undetectable, they cannot transmit HIV to their sexual partners. But what exactly does undetectable viral load mean? Well, it refers to the amount of HIV in a person's blood being so low that it cannot be detected by standard tests. So this is typically defined as having less than 200 copies of the virus per milliliter of blood. Achieving and maintaining an undetectable viral load requires consistent adherence to antiretroviral therapy. Now let's explore more what it means to live with HIV. If you've been diagnosed with HIV, it's natural to feel overwhelmed, but it's important to know that you are not alone. Support networks, counseling services, and community organizations are available to help you navigate your journey with HIV. Prioritizing your self-care is also essential. Engaging in hobbies, creative outlets, and social activities can also contribute to overall well-being and quality of life. Finding joy and fulfillment outside of the HIV diagnosis can help individuals maintain a sense of normalcy and resilience in the face of adversity. Ultimately, living with HIV is about more than just managing a medical condition. It's about embracing life with courage, resilience, and hope. By prioritizing self-care, accessing support services, and advocating for their needs, individuals with HIV can lead fulfilling and meaningful lives. Beyond medical intervention and self-care, it's crucial to address the stigma surrounding HIV. Stigmatizing attitudes can lead to discrimination and create barriers to prevention and treatment. So what is the action plan then? Well, education and empathy are key. Understanding that HIV is not casually transmitted and being mindful of language are essential in reducing stigma. So let's unite to break down barriers, promote compassion, and ensure that everyone living with HIV receives the support and care they deserve. In addition to the prevention methods mentioned earlier, I would like to emphasize the importance of harm reduction strategies as well, such as needle exchange programs for individuals who inject drugs. These programs provide sterile needles and syringes, reducing the risk of HIV transmission and promoting safer injection practices. For more information, visit canada.ca/HIV, and remember, reducing stigma starts with each of one of us being respectful, compassionate, and non-judgmental. So that wraps up my discussion for today. Thank you for tuning in, and always remember to spread kindness wherever you go. Thank you.
And now for some good news.
Have you heard the news? British Columbia has launched an initiative to combat cervical cancer. As of January 29th, 2024, individuals can now order a kit to self-screen for the human papillomavirus, or HPV, the leading cause of cervical cancer, in the comfort of their own homes. This is great news for those that don't feel comfortable going into their physician's office, or for those that don't have a family doctor. You can, though, still choose to have a traditional Pap test done in office. This program is part of British Columbia's 10-year Cancer Care Action Plan, which aims to improve the prevention, detection, and treatment of cancer, and aligns with the provincial government's commitment to increasing equity in healthcare access. Human papillomavirus, or HPV, is the most common sexually transmitted infection, according to the Canadian Cancer Society. HPV is a group of over 100 types of viruses, with some posing a higher risk by leading to cervical cancer and other cancers. It is estimated that around 75% of sexually active people will experience at least one HPV infection during their lifetime, but the absence of symptoms means most are unaware they've been infected. In most cases, the body naturally eliminates the virus without leading to any health complications. Persistent infection with high-risk HPV types, however, can lead to the development of cancerous cells in the cervix, underscoring the importance of regular screening. Cervical cancer is the fourth most common cancer globally among women. Cervical cancer is primarily caused by persistent infection with high-risk HPV types. Your risk of developing cervical cancer can be reduced by screening for HPV, and that is made more convenient now with these at-home screening kits. So who should screen? The BC Cancer Agency states that anyone who has cervix, including women and two-spirit, transgender, and gender-diverse people who are between 25 and 69 years old, should screen every 3 to 5 years. To order your free cervix screening kit, you can fill out an online kit request form at www.bccancer.bc.ca. That link will be in our show notes on Facebook and Instagram as well. The HPV vaccine is highly effective at preventing infections from certain types of HPV viruses that cause cervical cancers, as well as cancers of the anus, penis, vagina, mouth and throat, and genital warts. BC Cancer recommends that the vaccine be given to all children in grade 6 and before they become sexually active to be most effective. Routine screening is still important as the vaccine does not protect against all types of HPV that causes cervical cancers. For more information about the vaccine, you can go to immunizebc.ca.
True or false? Canada has a national sex ed curriculum. The answer is false. Each province administers its own curriculum. It's worth noting that the age at which this curriculum is taught also varies between the provinces. Question: true or false? The Canadian government's spending on public education has doubled since 1999. The answer is true. According to Statistics Canada in 1999 and 2000, the federal government spent $37.16 billion on public elementary and secondary education. In 2020 and 2021, the expenditure was $81.51 billion. Question: have chlamydia, gonorrhea, and syphilis rates increased or decreased in Canada since 1990? The correct answer is that these rates have increased. According to Action Canada for Sexual Health and Rights, throughout Canada, chlamydia, gonorrhea, and syphilis have been steadily rising since the 1990s. In BC specifically, between the years 2020 and 2021, the rate of reported syphilis cases increased significantly. According to the BC Centre for Disease Control, in 2020, the number of syphilis cases was 907 cases per 100,000 people. In 2021, the number of cases had jumped to 1,428 cases per 100,000 people.
Thanks for tuning in. If you are just joining us, you are listening to A Sound Constitution on CHLY 101.7 FM.
It's an undeniable reality that, as we age, our bodies change dramatically. When we were younger, we may have never thought about the possibility of having some of the health problems that we now face. However, it is possible to age healthily and get the most out of life at any age. While we may be primarily concerned about the physical effects of aging on our bodies, something that is not talked about enough in healthcare spaces is sexual health. The World Health Organization, WHO, defines sexual health as a state of physical, emotional, mental, and social well-being in relation to sexuality. It is not merely the absence of disease, dysfunction, or infirmity. Sexual health requires a positive and respectful approach to sexuality and sexual relationships, as well as the possibility of having pleasurable and safe sexual experiences free of coercion, discrimination, and violence. As humans, we're sexual beings, and sexual health is recognized as an important part of our overall health and well-being, according to a literature review published in the International Journal of Nursing Studies. While it may seem like a taboo subject to be asked about at your routine primary care checkup, there are many positives to having open conversations about sexual health with your primary care provider. In a study by Ports et al., published in the Journal of Sexual Medicine, 73% of persons aged 57 to 64 years of age and 53% of persons aged 65 to 74 years of age reported that they were sexually active in the previous year. Qualitative studies which report the lived experiences of adults aged 60 years and over show that they remain sexually engaged, redefining their intimate practices beyond sexual intercourse by finding unique ways to stimulate arousal and achieve orgasm. Many older adults now access online dating websites or the new smartphone dating apps to find new partners. Dating and repartnering in later life provide the opportunity to form new and redefined sexual relationships. Several positive outcomes are associated with sexual activity during late adulthood, including increased quality of life and maintenance of healthy personal relationships. Older age can represent renewed freedom and personal growth, which can improve sexual experiences. However, the risk for sexually transmitted infections, or STIs, including human immunodeficiency virus, HIV, is of rising concern among aging populations. In a study on sexual activity in older adults aged 60 to 90, published by the Australasian Journal on Aging in 2020, researchers found that participants wanted healthcare professionals to understand that their concept of what counted for sex was no longer predicated on intercourse. Other forms of sexual expression had taken a more central role once penetrative sex became less prevalent with age. The definition of intimacy changes as people age and goes from being centered around sex to a broader description of expressions of physical and emotional intimacy. Older adults visit primary healthcare clinics more often than younger people do, but to date, their sexual health and well-being needs have not been covered by healthcare guidelines. Older adults also often experience physical barriers to sexual expression like menopause, sexual or erectile dysfunction, vaginal atrophy and dryness, cancer, diabetes, benign prostatic hyperplasia, incontinence, dementia, and general fatigue. Emotional barriers to sexual expression include partner loss, caregiving, or care home residence. A study published in the Clinical Gerontologist in 2021 found that men and women with worse self-reported health were less interested and less satisfied with their sex lives. Older adults are known to be reluctant to talk about sex with their healthcare practitioners. The same 2021 study also found that 17.3% of adults aged 65 to 80 reported speaking to their healthcare provider about sexual health in the past 2 years. And of those, 60.5% of adults initiated the conversation compared to 39.5% of providers. Healthcare professionals appear just as reluctant to discuss sex with older patients, or at worst, to believe that their older patients are not sexually active, and therefore may not recognize the symptoms of STIs or barriers to healthy sexual expression in their older patients. Older adults felt that the healthcare practitioner should be the one to bring up sexual health discussions. Some expressed they felt their sexual selves were invalidated or dismissed by their doctors, in particular female participants. Others felt shame around the topic of sex, while some wished that sexual health was normalized by being a routine discussion at regular checkups. So what does this mean for you and I? Sex is a normal and healthy part of our lives as adults, and it's important to access healthcare for our sexual health as we age. A study by Stowell et al., published in 2023, recommends that healthcare practitioners provide tailored support for older people's sexual health, such as the importance of understanding that positive sexual experiences may be defined differently among older men and women. The study also found that a strong rapport with health professionals was key to facilitating an open and respectful discussion with their clients. As more older adults are entering into new relationships at this next stage of life, it is important to be screened for sexually transmitted infections to keep both yourself and your partner safe. Also, having discussions about how to manage health challenges around sex and intimacy can help increase sexual satisfaction. Increasingly, as more studies come forward highlighting awareness on sexual health across the lifespan, more healthcare practitioners have instituted sexual health screening at patient appointments. So please don't shy away from discussions about sexual health with your primary care practitioner. It may be the best thing you can do for your overall health and well-being.
Thank you for that, Lauren. Up next, we have a TED Talk from Jonathan Brandtman. He's a PhD student at The Ohio State University.
I lead a sex education team that teaches 1,000 OSU students per semester. And alongside condoms and birth control, we focus on the human dimensions of sex, like learning that you have a right to enjoy sex, learning great communication skills to make sure you and your partners enjoy it, and learning to talk openly with your doctor to get the best sexual health care. Our teaching is inspired by an idea from the 1970s women's rights movement, that having control of what happens to your body during sex is a big part of overall wellness for everyone. And I don't care whether you're having sex. My only concern is that if and when you have sex, you really know how to do it in the safest and most fun way possible. I know it might sound far out for sex education to cover these human dimensions of sex, like pleasure, communication, and healthcare, because American debates about sex ed often get stuck at a much more basic level, like debating if schools even should teach sex education. Fewer than half of American states require sex ed, many states don't require teaching contraception, and only 13 states require sex ed to be medically accurate. So a lot of us get stuck with high school sex ed that looks like the health class from Mean Girls, where the gym coach says, "Don't have sex or you will get pregnant and die. Don't have sex, you guys, promise, but also take these condoms." So in other words, we get high school sex ed that's incomplete, contradictory, and just not useful for our real lives. But in order to really protect our health, sex ed has to cover human topics like pleasure. It may sound unimportant or even inappropriate for schools to mention pleasure, but like one of my colleagues says, if you've never learned what great sex should feel like, how are you supposed to recognize bad sex, or even sex that's hurting you? Many women are still raised with the idea that sex is just going to hurt sometimes and you just have to put up with it. And if that's what you believe, how are you supposed to know that you have a right to say, "I want to stop," or "I want to slow down," or "I want to try more lube," or "try a different position"? This is why schools need to tell kids, you have a right to enjoy sex. And here are some ways to do it. Here are parts of your body that can feel great. Here are ways to touch those body parts for the best effect. First of all, none of us should have to learn about our bodies from inaccurate sources like porn, and kids should not be left unsupported to figure out good sources on the internet. And second, I remember a day in my third year of college when a friend of mine, a guy who'd been having sex with women for a while at that point, came up to me at lunch and said, "John, you take gender studies. Can you tell me, where's the clitoris?" And I was like, "Girl, if we want a future where straight men don't have to ask gay men how to find the clitoris, then schools need to openly talk about pleasure." But it's hard to enjoy sex if you feel scared for your physical safety. That's why kids need to learn great communication skills to make sure they and their partners feel safe during sex. I first realized this issue when I was 19 and came out of the closet and had my first date with a guy. And sitting there in our campus coffee shop in St. Louis, I realized, oh, this guy's a lot taller than me. If we were alone and he wanted to hurt me, there's nothing I could do about it. And I also realized, wait, when I've gone on dates with women before, did they have the same concern about me? This is an example of why kids need to hear, put yourself in your partner's shoes. If anything about this sexual situation might make your partner feel uncomfortable, put them at ease. Say something like, tell me what you like, or I only want to do what you want to do. And once you've used those communication skills to make each other feel safe, you can also communicate to make sex way more fun. So many of us feel ashamed of saying what we want during sex. But if schools are going to tell kids that their pleasure matters, then students need to build confidence communicating what they enjoy, so that in real life, people feel ready to tell their partners, I love it when you kiss my neck. Sexual communication is not only an issue in the bedroom, it's also an issue in the doctor's office. In order to get the best sexual health care, we have to feel confident bringing up some awkward questions with our doctors, and that takes practice. That's why students need to learn in class how to start conversations like, please tell me my options for birth control, or hey, I really need PEP, which is an emergency medication for HIV. A lot of folks here might be surprised to know that HIV can be cured in the first 3 days after you're exposed if you get this medication called PEP. But in order to get it, you have to know PEP exists and feel confident saying to your doctor, hey, my condom ripped and I need PEP right now. Now, these changes to sex education to cover healthcare, communication, and pleasure can start in our personal conversations, like when parents talk to their kids about sex. There are great online resources like O-School, Taboo, Fuck Yes, and Advocates for Youth that are made to help young people learn holistically about sex and made to help adults speak more openly on these topics with their kids. And you can also tell your schools to expand and humanize their sex ed classes. So often, schools only hear from parents about sex ed in the negative, when parents want to limit sexual information. But if you think holistic sex ed matters, please let schools hear your voice instead. And if we can make this kind of humanized sex education the norm in our conversations and our classrooms, we can move toward a future where no one thinks they have to accept harm as a part of sex. So let's all get out there and make sex education a lot more human. Thank you.
If you are just joining us, you are listening to A Sound Constitution on CHLY 101.7 FM. And here's Luke wrapping up our quiz.
True or false? Sex ed is essentially taught the same way everywhere in the world. The answer is false. According to the United Nations Education, Scientific, Cultural Organization, called UNESCO, international human rights standards require that governments guarantee the rights of adolescents by providing them comprehensive sexuality education in primary and secondary schools that is scientifically accurate and objective, and free of prejudice and discrimination. Again, according to UNESCO, it's estimated that only 20% of countries globally go beyond policy making and make it law to teach adolescents sex education. Of the countries that do make sex ed law, take for example the Netherlands. In a recent article by PBS NewsHour, it was shown that the sex ed curriculum in the Netherlands was created by a sexuality research institute called Rutgers WPF. This curriculum attempts to be as comprehensive as possible. According to a Rutgers WPF researcher, kindergarten kids as young as 4 are taught about sexuality by having conversations about love and relationships. The researcher quoted in the article is named Enek van der Kloot. When asked about the curriculum and its aims, she says it is about encouraging respect for all sexual preferences and helping students develop skills to protect against sexual coercion, intimidation, and abuse. The underlying principle is straightforward. Sexual development is a normal process that all people experience, and they have the right to frank, trustworthy information on the subject. The article goes on to state that in the Netherlands, birth control pills are free for anyone under the age of 21. According to the World Bank, the Netherlands has one of the lowest teen pregnancy rates in the entire world. So that's all for today's quiz. A note to our listener: if you are curious or have any questions regarding sex education, or just anything that was touched on in this quiz, please refer to the show notes for this episode. We hope you found it informative.
Next up, we're going to be speaking with Anita Carroll. She is a professor at Vancouver Island University and a registered nurse at the Options for Sexual Health Clinic here in Nanaimo. Anita, thank you so much for joining us today. We're so happy you could be here to share your wealth of information and knowledge. Can you tell us a little bit about yourself and your role as a nurse at Options for Sexual Health?
Thanks, Nikki, and thanks for involving me in your learning at A Sound Constitution. So first off, I just wanted to acknowledge that I'm coming from the Cowichan, the lands of the Cowichan people, and specifically where I live, I'm on the village of the Quamachan people, and grateful to live in this beautiful area and to be able to raise my children here. And I have been a part of the Options for Sexual Health. It used to be called Planned Parenthood, and I joined their team in 1996. And I was there for quite a few years. And then I took a little hiatus while I was having kiddos. And then I've gone back now. And now it's known as Options for Sexual Health, as you said. It's just a beautiful area to be able to work. In addition to being a teacher at VIU, working with sexual health across the span of life is something that's important to me. And how do we make it normal to actually be okay with getting treated for sexual health and not have any taboo or stigma with it?
And that's what we're here to talk about today. Thank you so much for sharing that with us. Options for Sexual Health has over 60 locations across the province, and we're lucky enough to have a location right here in Nanaimo. Can you give our listeners some information about the services that Options provides?
We're a nurse-run clinic, so all of the nurses have certified practice for STI testing and also counseling. And we usually have 2 nurse-run clinics 3 nights a week, and we offer all testing for STI testing. So we will take urine samples or swabs for chlamydia, gonorrhea, and trichomonas. If women have issues with BV or yeast, we can swab for that as well. And then we give clients a requisition to go to Life Labs to get blood work done for hepatitis A, B, and C, HIV, and syphilis. And if tests come back positive, we do have all the treatments at our clinic. So we bring clients back in and treat them and offer those services. We also do counseling and offer counseling for, it could be youth who are struggling with their sexuality, or it could be older people who have, they've been married for 30 or 40 years and a partner has passed away and they're coming in exploring their sexuality. And we also have a lot of people from all diversities of sexuality who come into us for treatments. And we offer all of that as well.
We are really fortunate to have a clinic like this to support the needs of our community, especially around sexual health, and not just the physical aspect, but also our emotional needs as well. In your experience, Anita, do you think that people have difficulty discussing their sexual health? And if so, why do you think that is?
That's a big loaded question. I have lots of thoughts on that. So I think quite often sexuality is not spoken about because people don't feel comfortable talking about it, whether it's parents teaching their children about sexual health and ways of being, to the education in the school system, and then people just feeling embarrassed to be able to ask questions about their sexuality. So for me, my goal is to make people feel comfortable. It doesn't matter to me where you are on your scale of sexuality. I just want to make sure that if you're having sex, that you're enjoying yourself first off, that it's consensual and you're feeling comfortable, and that you're having fun, because sexual health should be fun. We are born sexual beings and we die sexual beings. So how do we kind of try to figure that middle part out to make it okay? And some of the things that I've been thinking about is, many years ago when I was a public health nurse, this was our job to go into schools and teach this to the kiddos and the teachers about sexual health. And, in the 90s and early 2000s, my job as a public health nurse has been basically eradicated, that we don't do that anymore. Public health is looking at immunizations, baby health, some maternal health, which is all important, but we don't have these experts going into the schools now doing this teaching. And I know school teachers, part of their curriculum through the BC School and the Ministry of Education, they're supposed to be doing this teaching. And some teachers do a really great job of it, and others are doing it, but they're feeling really embarrassed and it's hard for them to do. So there's so many mixtures in there about what we can do. But for me, it's just when someone comes into the clinic and they're embarrassed or they have something wrong with them, I just say, you know what, this is a body part and I'm just going to treat it or look after it just like I would anything else. And in my teaching, so as you know, I teach at VIU, but I also teach with some of the nursing students in practicums, and we go into schools and we do teaching. And I say, if you got bitten by a dog, you would go and you would have stitches and have your arm cleaned up. If you broke your arm, you'd go and get a cast on. Why in society do we still have stigma around sexual health and mental health? Like, they're two really big things. And it's just, for me, it's like, how do I make people feel comfortable so that they can come in and ask me questions and get them the best help they can? And I think that's one thing that we do really, really well at Options, is that we care for anybody who comes in, and it doesn't matter what's going on. We want to be able to be there for them, to give them the best support, help them to make the best choices, and teach them about their sexual health so they are comfortable about it.
I think it's so important to increase that comfort and open up that dialogue around sex.
Yeah.
That we do normalize it. Sex is normal. Sex is fun. And it is, body parts are just that, body parts. And
the more we talk about it and make it okay, there won't be as much problems, because you do see it, right? People come in and they're nervous about doing it. Or the thing that's upsetting for me is that, especially younger people who don't feel comfortable, they don't know how to ask or give proper consent, and they're doing things and getting hurt. And it shouldn't be that way, right? There's a lot going on. And this could be probably a whole other topic, but when you see what some youngsters are seeing online and they have the access to devices to be able to look at things that is not actual, pornography is not actual consensual. Yes, this is what we want to do. And I think sometimes some of the younger population that we deal with, they're seeing things that aren't necessarily the best for them health-wise, and they don't know any different. So for me, it's like, how do we educate to say, like, this is my body, this is what I want to do? No, that doesn't work for me, right? And that's another piece too, is I see clients who come in who've been in long-term relationships, and they'll even say to me, I've been with this partner for a while and they like to do this, but I don't like to do that. And I, work with them like, well, how do you say no? Like, that's not what you want, right? And it always shocks me to see how people don't know about consent and how it can be changed, right? It doesn't have to be that way the whole time. You can change, and that's okay. And that's part of a dialogue in partnerships, that you have to be able to do that and do that comfortably so nobody is getting hurt, right?
we're going to pause here for a moment to listen to the Tea Consent video by Blue Seat Studios. This is an educational video that uses the analogy of making someone a cup of tea to explain the concept of consent in sexual situations. Let's have a listen.
If you're still struggling with consent, just imagine instead of initiating sex, you're making them a cup of tea. You say, "Hey, would you like a cup of tea?" And they go, "Oh my God, I would love a cup of tea, thank you." Then you know they want a cup of tea. If you say, "Hey, would you like a cup of tea?" And they're like, I'm not really sure. Then you could make them a cup of tea, or not, but be aware they might not drink it. And if they don't drink it, then, and this is the important part, don't make them drink it. Just because you made it doesn't mean you are entitled to watch them drink it. And if they say no thank you, then don't make them tea. At all. Just don't make them tea. Don't make them drink tea. Don't get annoyed at them for not wanting tea. They just don't want tea, okay? They might say, "Yes, please. That's kind of you." And then when the tea arrives, they actually don't want the tea at all. Sure, that's kind of annoying as you've gone to all the effort of making the tea, but they remain under no obligation to drink the tea. They did want tea, now they don't. Some people change their mind in the time that it takes to boil the kettle, brew the tea, and add the milk. And it's okay for people to change their mind. And you are still not entitled to watch them drink it. And if they're unconscious, don't make them tea. Unconscious people don't want tea. And they can't answer the question, "Do you want tea?" because they're unconscious. Okay, maybe they were conscious when you asked them if they wanted tea. And they said yes. But in the time it took you to boil the kettle, brew the tea, and add the milk, they are now unconscious. You should just put the tea down. Make sure the unconscious person is safe. And this is the important part again. Don't make them drink the tea. They said yes then, sure, but unconscious people don't want tea. If someone said yes to tea, started drinking it, and then passed out before they'd finished it, don't keep on pouring it down their throat. Take the tea away. Make sure they're safe, because unconscious people don't want tea. Trust me on this. If someone said yes to tea around your house last Saturday, that doesn't mean they want you to make them tea all the time. They don't want you to come around to their place unexpectedly and make them tea and force them to drink it going, but you wanted tea last week. Or to wake up to find you pouring tea down their throat going, but you wanted tea last night. But if you can understand how completely ludicrous it is to force people to have tea when they don't want tea, and you're able to understand when people don't want tea, then how hard is it to understand it when it comes to sex? Whether it's tea or sex, consent is everything. And on that note, I'm going to go make myself a cup of tea.
If you are just tuning in, you are listening to A Sound Constitution on CHLY 101.7 FM, and that was Tea Consent by Blue Seat Studios. A link to the video can be found in our show notes on our Facebook and Instagram pages. Welcome back to our conversation. We are talking with Anita Carroll, a professor at Vancouver Island University and a trusted nurse at the Options for Sexual Health Clinic here in Nanaimo. Picking up where we left off, we are discussing the importance of consent and increasing dialogue around sexual health.
For me, it's like, how do you rehearse the consent piece back and forth with people? Because there's adults who can't do that, and I have people even in their 50s and 60s who come in and they're still saying like, I don't want to do that. I'm like, then say no. And they can't do that. So it's almost like you need to, I think consent stuff needs to be woven through right from, I started with my kids at a young age. But you see, when it gets to teenagers, you have to keep going, and even into young adulthood. Like, I'd love to see some workshops on campus that we could be doing about consent.
Consent, empowerment, and bringing it back to using proper words for body parts. And
yes.
That goes a long way in being able to say no and say when something's wrong.
For them to know that there's a safe adult they can go and speak to. I know I'm a mama who's known with my kids, and many of their friends come to ask me for advice, and I try to help them out as best I can or direct them as I can. And I think that's part of our role as nurses. We're also educators, and how do we inform people so they can make the best choices for themselves in that moment, right? 2 weeks from now, it might not be the right one, but in that moment, what do you need and how can I help support you, right? So, yeah.
Absolutely. I'm just going to circle back here for a minute. You mentioned earlier that people can find out information and be tested for sexually transmitted infections at Options for Sexual Health. I recently read a stat from the BC Centre for Disease Control, or the BC CDC, that the number of cases of syphilis has almost doubled in the past 5 years. What do you think is the main contributing factor for this? And what do we need to know, and how can we prevent it from spreading?
That's again, you got some good loaded questions there for me today, Nikki. So yes, it has risen, and anybody can find these statistics if they go onto the BC Centre for Disease Control, and you can look it up, but it has increased. I think it was back in 2010, there was 3.4 people to 100,000 people in 100,000 who tested positive. So that year, there was about 154 cases of syphilis in the province. And then in 2017, there was like a 30% jump. There was 761 people tested positive for syphilis. So anybody can get syphilis. It's depending on your behaviors and what you're doing. And the biggest population who have this are gay, bisexual men, and they're 1 in 100 who end up with syphilis. But that's not like we're targeting that population, anybody. I've tested many people, young and old, who've come in with syphilis. And when you sit down and you start talking to them and you're asking them about their lifestyle choices and behaviors and what they're doing, a lot of the people who speak to me, they have been under the influence of something at a party or whatever, and their guard has been knocked down and they've done stuff that maybe they wouldn't necessarily do. Other people will do different things, even if they have the education, because they don't think it's going to happen to them. And how many of us actually feel like that? Oh, I'll be okay, don't worry. And then some was just an accident, didn't mean to happen, and it's just sometimes one time could be the only time, and that's what we could see happening. So yeah, I would pull in to the factors that, if you're substance using, if there's some mental health going on, or there's other personal factors going on, sometimes these things put our guards down and people aren't a mindset that is safe to look after themselves in that moment. And again, we're all human. We all make mistakes. Even those of us educated with all of these things and know better, we can make mistakes. And I think that's the biggest thing, is that you don't want people coming away feeling embarrassed or harmed or feeling like they're stupid, because we've had people say that as well. I just say, you know what, this is just a whoops, let's get it taken care of, and then you just come back for your other needs. So for me too, you don't want to be stigmatizing, shaming people, or making them feel bad that they've done something wrong. It's just like, how can we help you? And then we just review and talk about healthy sexual life and what you can do and make it fun. And, one of the biggest things is always using protection. And you can make that fun too. It doesn't have to be, oh gosh, we're putting on the condom, or we're using this, or we're using that. It's just being upfront. Let's do this and protect myself, and I'm protecting you at the same time. Yeah, it's about education, and it's about being safe and getting tested regularly. Every time you have a new partner, come in and get tested. And that's the other thing I would say. I think it might lead into this, to some of your other questions. But when you go in and get tested, and then you show your partner or say, hey, I've been tested and I'm clear on this, or this one that comes up quite often, somebody comes in and is like, oh, I had a herpes outbreak, or HPV, or HSV. They're two different things. Outbreak, and I don't want to impact my partner. What can I do? So then that's some of the things we'll do at Options, is we'll talk people through that, and we can help them get the treatments that they need to, so that they can have them on hand if they have another outbreak. But for me, I think the biggest thing is, let's just talk about it. Let's make it normal, and let's just try to work around it and get rid of any stigma or shaming that happens, because there's enough of that in the world. We don't need that. We want people to be healthy and well and have fun.
And that's why we're here, to destigmatize talking about sex and normalizing the conversation. I think a lot of the time it's the stigma that's harder to deal with than the actual sexually transmitted infection itself.
Mm-hmm. I agree. Yeah.
Which leads me to my next question. There seems to be a lot of stigma around being tested and testing positive for sexually transmitted infections. Do you have any advice for those who want to talk to their partners about their STI status or other sensitive topics?
Well, yeah, it's sad for me that there's still stigma around this. I've been doing this job for a long time, and I often joke, I was brought up in a Catholic school in northern BC, and I often think that the principal, who's long since passed, must be rolling around in her grave sometimes, because I'm working at one of these clinics, and of course, being Catholic, how we were taught, this is all a no-no. But for me, it's like I need to give people the information to make the best choices for them in that moment, right? So that's where I come from. So the stigma and the shame, when people come into the clinic to me, I just, treat them just like there's somebody that I know, and I just make it all normal. Like it's, if you're going into the dentist to get your teeth cleaned, like it's the same type of thing. Do you have any aches or pains, any sensitive spots with your teeth? I'm like, same thing. Hey, have you had any issues? Oh, you have a sore there. Let's have a look at it, and how we can swab it, or let's send you for other testing. And I think it's just the nurses and the clinicians and the doctors, but I know for us, because we're a nurse-run clinic, it's just, how do we just make this normal, inviting, and just come back if you need testing. And I think we have a pretty amazing team of nurses at Options that we do that. And, here's a prime example. We did have to shut down during COVID for a year, and then we moved to a new clinic space. And I think we had about 900 new clients all of last year. And when I was on clinic last week, we were already had 110 new clients since January. We're a very busy clinic. We could be open 5 days a week. We could be open full days. And we have people come from, from Victoria to Fino, up Island, everywhere in between, to come for testing, because a lot of people don't have physicians right now, and it's hard to do this, right? So I think, going back to your question, yes, there is stigma around it, but I think us as staff at Options, there is no stigma. You're a human being who's coming in for a health concern, and we're going to treat you, and we treat you with respect. And the advice to talk to partners, I think that's one thing that, as parents, we should be doing right from day one with our kiddos, teaching, again, going back to the consent piece, starting that early, and just talking to kids about their bodies and the great science experiments our bodies are, to make it normal, so that when things come at puberty time, it's not like, oh my God, what's happening to my body? They're already feeling comfortable because we've spoken to them about that. And then you start talking about relationship talk, and how do you talk to a partner? And even if you look at teenagers right now, most of them are on their phones, texting one another, not actually looking at one another and speaking to them, right? So teaching them how that's important, having healthy conversations. And then that rolls into, when you're into relationships, how are you going to have those conversations? Sometimes with some clients, I actually role play with them how they're going to talk to their partner, because they're so anxious and nervous, and I will do that. But I hope when we have these conversations, say, this is part of your self-care, and you have to have these conversations with your partner, and you've learned from this mistake now, but in future, new partners, what are you going to do? Saying, well, I was with somebody, I had this. So if somebody had, say, a herpes outbreak, and they may not have had it for 10 years. Maybe it's dormant, but that's still to say, hey, I actually had this 10 years ago. I've not had any symptoms since, but I just want to let you know. And maybe we should still use protection because, some of these STIs, you don't have symptoms. You don't know when you're going to have another outbreak. So using protection is going to look after your partner. And that's called respect in a relationship, right? So I think, so any of those sensitive topics or STI status, just sitting down and say, hey, can we have a chat? I want to talk to you about this before we start having relations.
You make it sound so easy, Anita, and it really should be. According to the clinical gerontologist in 2021, 60.5% of patients aged 65 to 80 initiated conversation about sex with their healthcare providers, as opposed to only 39% of physicians that initiated conversations with their patients. Where do you think this reluctance comes from?
Again, it could be multifaceted here. GPs have a lot on their plate and they're running from patient to patient, and we see the low numbers of physicians we have available in our province to look after everybody. So they could be focused on certain things, and unless you're coming in to say, this is my problem, they may not ask you about that, right? So I see it that sense. If a client is coming in for one thing, but they have this other stuff going on, they need to make that upfront, right? So they can have that focus in that appointment. And I think maybe, 65 to 80, you've been around the block a few times. You probably feel a lot more comfortable, like, hey, I need help with this, or this isn't working right. What's going on here, right? And they feel more comfortable to bring it up that way. And again, maybe some physicians might not be as comfortable to bring up some of those topics, or they may think if you're 65 to 80 that you're, like I said, you've been around the block a time or two, you know how it all works, that might not be an actual issue for them or a concern, right? So, again, it's about how do we advocate and teach people to ask the questions so that they're learning and there's no issues around it.
What do you think that we as healthcare providers can do to reduce the stigma around sex and talking about it? How can we make it more comfortable for people to talk about their sexual health?
Just like you said, talk about it. Don't be embarrassed about it. Don't be ashamed about it. There's also cultural factors, as religious factors that sometimes get involved with what you're allowed to do or not do. If you have a mom and dad, guess what? They had sex and you're here. Doesn't matter what your religion is or what your culture is. Procreation happened, right? And this is part of our body's roles in the world that this happens. And again, we spoke earlier on about sexual health, and we've been born as a sexual being and we die as a sexual being, and wherever you are in that spectrum of sexuality, because you could be someone who is monogamous, heterosexual, it could be open relationships, it could be you're asexual. Like there's so many areas on that spectrum, and I think that's the biggest thing, is let's just be open and free and talk about it and educate early. And I know there's a lot of people who kind of push back about the SOGI teaching in schools, but I think it's really important that we do teach our children according to their age and their development what they should be aware of, because that helps break down some of that stigma. That also helps kids to be able to have dialogue if we're practicing these things. So it's making that it is normal and it should be normal. The more we do that, that builds up their confidence and allows them to feel more comfortable to be sharing what they want or don't want. And hopefully that will answer some of those things. And again, like even as a student nurses, like, are you asking your clients when you're in the setting with them about their sexual health, or are you poo-pooing away from it, right? And again, we all have to become comfortable with it and educating ourselves. You can listen to podcasts. There's lots of great podcasts out there. There's different courses that can be taken. There's so much that you can do to make it normal and healthy, and there's nothing wrong with it. So hopefully that'll take away the stigma. And, just with anything, the more you practice, the more you talk about it, the easier it gets, and it just comes out, right? So taking that time to do that, as student nurses, you have to learn certain skills, you practice them, right? And one analogy I like to do with students is like, how many of you drive a car? And you see the hands that go up and like, okay, so did you just get in a car and drive and you had your license? No, you had lessons. You had to take it slowly. You had to learn the rules of the road, all of these things. Like there's a little ladder up to where you get to, right? So this is the same with sexual health. To feel comfortable and just take a little bit each time and move up. And hopefully that will help take away the stigma and the shame around it.
Increasing education and dialogue around sex. This is great advice. And thank you for leading by example.
I try.
Is there anything else you would like to share with our listeners today, Anita?
Well, I just think it's great that student nurses are tapping into some of their teachers for some of our expertise, because it's lovely to be able to share in a different way. And I appreciate that. I think for me, I would just like to, if anybody's having any issues or worried about anything, or they have a sore they're not sure about, if they need testing and they don't have a healthcare provider, that they're welcome to come to see us at Options for Sexual Health. Right now, we do clinics on Mondays, Tuesdays, and Wednesdays from 5 p.m. to 8 p.m. And we can do any testing that's needed. And we're at Unit 8, 1599 Dufferin Crescent. So we're right across from Nanaimo General Hospital in the Public Health Building. It used to be where the Windward Pub is. We're downstairs behind them. So they're welcome to phone the clinic at 250-753-9511, and they can book an appointment. And we can usually see people within a week or two of them calling in. And that's the other thing I forgot to say too, is that we actually have birth control available, which is so great. It's free in British Columbia, and we can offer that. We have those different types of birth control at the clinic that clients can get as well. But yeah, I welcome anybody to come in and see us at the clinic. And thank you, Nikki, for giving me this opportunity to talk about one of my passions in nursing. This is great. Lovely to work with nursing students in a different way.
Yeah, thank you so much for being here today, Anita, and sharing every bit of knowledge that you come with. It's invaluable and so important to get the dialogue open and flowing about sexual health. It's nothing to be ashamed of, and so important that we get comfortable with this topic.
Absolutely.
And once again, this is Anita Carroll, our professor at VIU here and nurse at Options for Sexual Health in Nanaimo. And I will post a link to Options for Sexual Health in our show notes so you can access all your sexual health needs. Once again, thank you, Anita, for joining us today.
Most welcome. Thank you.
If you were just joining us, that was Anita Carroll, professor at Vancouver Island University and registered nurse at the Options for Sexual Health Clinic here in Nanaimo. And that wraps up our episode for today. I'd like to extend my gratitude to Anita Carroll for taking her time to talk with us today about reducing stigma and the great work she's doing as a nurse at the Options for Sexual Health Clinic here in Nanaimo. A big thank you to our listeners for tuning in, and to my amazing co-hosts Jamie, Lauren, and Luke for contributing to the dialogue around sexual health. Tune in next week for another great episode. For details and show notes from today's episode, or to follow along on what's coming up this season, check out our Facebook page, A Sound Constitution, our Instagram, CHLY, A Sound Constitution, or our Twitter at ASC_VIU. If you've missed parts of this episode, or would like to listen to this episode, or episodes from our past shows, check out our YouTube at A Sound Constitution. Otherwise, we'll see you all next week.